obviously the first element is a review of our work last year in 2019 and 20. And just as that year was coming to an end, COVID broke. So we thought it was really useful to get an update on COVID from one of the leading people in Sandwell, Dr Lisa McNally. So she'll be joining us in a few moments. What we want to do is make sure there's sufficient time for you to ask us questions or make comments or give us some suggestions or observations. So there will be two kind of main slots for that. After Lisa has spoken, which will be about 10 to 2, and after the Healthwatch team have reflected on last year and outlined our plans for next year. If you can go on to the next slide, please. I'm relatively new to virtual meetings, and I think there is a sort of a way of making them most effective. As we've got over 20 people on the line, if you're not directly speaking and you feel okay doing it, it's sometimes quite useful to turn your camera off because it improves the bandwidth. Likewise, if you're not speaking, if you're able to mute your microphone, that's also a really good thing because it just helps with background noise. But we do want this meeting to be about you. So there's two really easy ways for you to say you want to get involved. One is if you look at the little menu that pops up when you click your screen or your mouse, there's a hand gesture. If you raise your hand, then the team will see it and we can invite you in to comment. Likewise, next to the hand, the next box along, which looks like a kind of speech bubble, is what's called the meeting chat. And that's basically an online messaging forum that you can chat to everyone on the call, or you can select a particular person and send them a private message. So if you are able to open up the meeting chat, it just means that we can note any questions you've got, or you can let me know that you've got a question you want to raise, but you can also make general comments as well. Because this is our annual public meeting, we are going to record this session. So if you don't want your face shown, again, that's another reason if you want to switch your camera off. So I think that broadly is the kind of rules of this. This meeting is due to finish by 2:30, and as the chair, I'm intending that we stick to that. So that hopefully will allow people to get on with other things this afternoon or jump in the shower because I'm absolutely baking with the heat today. So I don't think Lisa's quite joined us yet. So if I hand over to, well, let's first of all check if there's any basic questions about how the meeting's going to operate or how to use Teams effectively. Anyone got any questions or points they want to raise about that? I'll take that as a no, because I can't see any hands and I can't see any messages on the chat. So Lex, do you just want to introduce the team to start us off? I should perhaps probably more formally say Alexia Farmer, who is the Healthwatch manager, please, it's lovely to have you on the call because you've helped organise this with the team, but I'll hand over to you.
Okay, thank you. Thanks, John. Melissa, can you just alter the slides, please? Okay, so just while we're waiting, I'll give a sort of a brief introduction to myself and the team. So I've been in post for over a year, and I have been lucky to retain an experienced and knowledge staff and volunteer team who have been nothing but supportive during our sort of transitional year. 2 new members of staff joined us, along with 4 new volunteers, and they complement the existing team, which has helped to shape and enhance our operations. So over the past 12 months, we've taken time to review the quality of the service and make some of the necessary changes to sort of enhance what we can deliver. And we've also been developing our relationships with key stakeholders and partners, as well as the local people. And throughout the year, we've successfully worked on a range of priorities, some of which you will hear later on in the presentation after we've heard from Lisa. Just briefly about the plans for 2021. We're all ploughing through the challenges that coronavirus has presented us with. But we do look ahead with optimism in developing our work programme. Obviously, the way we work has drastically changed, and I really must pay tribute to how the staff team have adapted to that. We've had to be really creative in how we get our messages across to the people of Sandwell. So I think we've possibly got time, yes we have, to share with you a clip that we put together demonstrating our creativity during the lockdown. This was put together virtually. We didn't come together to do it. So I'd like to introduce you to Ian, Melissa, Anita, Sophie and Leanne, who are part of the team, and hope you enjoy the short clip. It will come in a minute. Give it a kick, Melissa.
We need to put 50p in the meter.
Just to share with you, we've had terrible problems with the IT this morning, trying to get it all sorted out, whether it's going to work or not. Okay, so Lisa's waiting in the lobby. Lisa's waiting in the lobby, John. So somebody let her in. Lisa, are you in the meeting?
Hi, Alexia.
Hi, that's good. I didn't let you in, so we've got some secret letter in here somewhere. But thank you and welcome. Okay, we were just in the process of just introducing the team and showing a short clip, but we're having a few problems in getting that onto the screen. So I think Melissa, bypass, and I'll hand you back over to John. John, can you hear me? John, can you hear me? Can somebody give an indication if they can hear me speaking, please?
I can, Alexia.
Okay.
Hi.
John, can you hear me?
Yes, I can hear you.
Alexia, I can hear you. There's a lot of background noise. It's false.
Thank you, everybody. Can I just remind people, if they're not talking, if they can mute their microphones, just really helps with background noise. Thank you to the staff team for that video. It really encompasses both what we try to do, but also how reliant we are on members of the public to hear their experiences, their concerns, or their ideas going forward. And I know Deska's already asked a question on the chat about our priorities for next year, and that's exactly what we want this meeting to be about. Before we go on to look back over the year, we're delighted to be joined today by Dr Lisa McNally, the Director of Public Health for Sandwell. Now, you know, COVID kind of broke in this country in the popular imagination in March, just as a sort of financial year was coming to an end. Very few of us really saw it coming, and I guess none of us had really any idea what an unprecedented impact it would have, both on all our lives, but on the health and social care system in particular. There's been many heroes across the world through COVID-19, but I think we've got a very special local hero in Lisa. Lisa has shown real leadership, she's shown authenticity, she's been really visible both nationally and most importantly locally. She's challenged when it's right to do so, but she's always shown compassion and brought the community as a champion at its heart. So we're really delighted, Lisa, that we got you on a very busy day. I'm sure you've got lots of other things you need to be doing for the next half hour. So over to you, and very, very welcome.
Thank you, John, and thank you so much for the invite. Alexia, can I just check, can you hear me okay? Just give us a thumbs up if you can hear okay.
Yes, I can hear you, Lisa.
Lovely.
Thank you.
Okay, so what I'm going to do is share my screen, and what I thought I'd do is cut straight to the chase really and show you where we are at the moment in terms of coronavirus rates, etc. So Alexia, can you see my screen?
Yes, no problem. I can see your screen. Thank you.
Great. Thank you. So I won't take long. I apologise for the number of bar charts and graphs, but of course, COVID-19 is very much at the start of our response, a statistical response. It's our job to not just know what's going on, but to have some idea of what's coming down the line, which is very difficult with a virus that transmits in the way the coronavirus does. But we do our best. So let me show you firstly a timeline. Now, that graph you can see is a trend of the whole pandemic. So right on the left, on the bottom are all the dates, and the higher the line goes, the higher the number of cases. And you can see, now this graph takes us, because you won't be able to see the dates, right back from the 17th of March, which was really the start of the pandemic in earnest. Before then, it seems like so long ago now that do you remember seeing the cases come in on the bus and everyone was asking why the bus drivers aren't wearing PPE, and everyone was absolutely petrified about the idea of having a positive coronavirus case even in their area. How times have changed now, and in terms of our attitude to it. But the very left-hand side of the graph is the 17th of March, and it takes us all the way up to the current week. So those of you who can see closely enough, the lines that you're looking at are the 4 Black Country areas of Sandwell, Walsall, Wolverhampton and Dudley, with Sandwell being the green line, and the blue line is the England average. And what this looks at, as I said, is the number of COVID-19 cases per 100,000 population, and it's smoothed out by taking the 7-day average. Obviously, we give numbers per 100,000 population because that allows us to compare areas of different sizes. And the most notable thing you'll probably spot on that graph is over towards the right-hand side, where you can see a recent surge that I'm sure you've all read about in Sandwell. And what you'll see is we peaked very rapidly, particularly in the area of Smethwick. we did a lot of intensive work in Smethwick, and I'm sure some of the people we worked with are actually on the call today. And my thanks go out to all of the community organisations in Smethwick, including some really awesome faith leaders. And we've brought the cases back down, but we are seeing now an increase again in Sandwell. This time it's driven not just by Smethwick, but mainly actually West Bromwich. So if I go to the analysis by town, you can see there the 6 towns of Sandwell in blue and the numbers of cases that we've had this week in red. The numbers in black are the cases per 10,000 population. And you can see that West Bromwich and Smethwick are really sort of quite close in terms of the number of cases. West Bromwich was in front up until a couple of days ago, but some of you may have seen that we had a large outbreak at a pub in Smethwick, where we had 70 people who were at a African music and food festival barbecue at a pub in Smethwick. And unfortunately, social distancing wasn't great, as is often the case in pubs. Many of you will have been to a pub since we come out of lockdown and witnessed for yourself how difficult social distancing is, especially as the evening progresses. So we've seen a surge there again because of that pub barbecue. There is a slightly more granular breakdown, and that covers the electoral wards. So those of you who are familiar with the electoral wards that know that Soho and Victoria is in the Smethwick area, and is actually the location of the pub. It's where the pub was. But you can also see West Bromwich Central is up there, and also Smethwick and Newton and Greeks Green and Ling. So you can really see how Smethwick and West Bromwich are really leading the way, and probably the best illustration of that is this map. So when you look at this map, you'll see green shading, red dots and blue dots. And essentially what happens is when a case first appears, it appears on the map as a red dot. Then after a week, it turns blue. And then after a week, it fades into the green background. And the darker the green, the higher the number of cases per 1,000 population across the whole pandemic. And you can see a real corridor there. It's actually less stark than it's been in recent weeks, but we have a big cluster around Smethwick and a cluster around West Bromwich. The pub I talked about is located here. On the right-hand side, for those of you working in healthcare, the right-hand side table is probably the most important information of all, because what you'll know is that coronavirus discriminates on the basis of age, not in terms of who's most likely to be infected, but who is most likely to be seriously ill if they are infected. The death rates in over 70s are 10 or more times the death rates that we see in younger people around their 20s, and even higher than children. Children very rarely become ill with coronavirus. They would normally have to have some sort of comorbidity, like a severe lung condition. And you can see that 12% of our cases are actually over the age of 60. And we've got in that period, 27th of July to the 9th of August, so 2 weeks, you can see that we've got 8 people over the age of 70. Now, those are the people we are obviously worried about, and those are the people that are most likely to become ill if infected. Luckily, as you can see, most cases at the moment are of really early working age, I would say, from 20 up to 45 and 50. So moving on to those consequences, because of course when we all look back at this period, you know, I guess a lot of us will be talking about 2020 and the COVID-19 pandemic for the rest of our lives. I certainly have talked about nothing else for about 8 months. But when we look back, how will we count the cost? And of course, the number of cases is of course important. It's incredibly important for managing the pandemic. But what the cost is really counted in is serious illness and of course death and bereavement and loss of loved ones. At the moment, we're not seeing a significant increase in either patients in critical care in our local hospital trusts or in the number of deaths. Also, of course, one area that we are particularly and always concerned about are care homes. And this graph shows the number of deaths in care homes. And over on the left here goes from April through to mid-April through to mid-May. And you can see the number of deaths we were getting got actually up to 2 a day at one point. I can honestly say it was one of the most difficult times of my career as I worked as part of our 7-day outbreak response team, which at that time was very much focused on care homes because this was a time when nowhere else was open, you'll remember. The schools had closed, the shops had closed. We were only going out, what was it, for one form of exercise a day? It seems so long ago, but that was our reality then. And the battleground, if you like, was in the care homes. And my just utmost admiration goes out, not just to the team who worked with me on the outbreak response, but to the absolute heroes. And they don't like me saying this, I know that, but to the absolute heroes that worked in the care homes. I remember doing an interview in the media once, and I was just reflecting with the journalist that I'll never walk past a care home again and not notice it. You know, unlike a hospital with its big imposing cathedral-like presence, we notice hospitals. But care homes, behind those sort of neatly kept gardens and subtle buildings that blend into residential areas, an absolute war was being fought. As you can see now, the care home deaths have reduced significantly, but they still remain the thing that keeps me awake at night. And every time I read about or see another infection in one of our care homes, I worry. Because in all those cases I showed you earlier, 200 or so cases of coronavirus, I would expect less deaths in those 200 cases than I would from one care home outbreak. And, we really need to see those settings as our absolute priority. Luckily, so far to date, you can see that Sandwell care home deaths per 100,000 population was significantly lower than other areas in the Black Country. And again, massive tribute to the people who made that happen in the public health team, in the adult social care teams, in the eye care service and other hospital teams, and of course, most importantly, the care home staff themselves, and the bravery of the residents and of course, the families of the residents who haven't been able to visit their loved ones for a long time now. But there's no success there. Every death is someone who lost out on some more life, someone who's missed by a family member. And as I said, we need to keep protecting our care homes as much as we can. So I'm sorry, I'm losing my voice rapidly because I'm in a lot of meetings at the moment. So I'll unshare my screen and come back to you, Alexia.
Okay, thanks, Lisa. Apologies for the racket I seem to have been causing before, but must be some technical issues going on with my my system. John,
Lisa, there's a few questions that have come in while you were going through those graphs. I don't know if you can see the chat function, but if I just read them out, the first one's from Martin. He says, are all care homes in Sandwell now getting both staff and residents tested?
Hi, John. Sorry.
Hi.
Sorry, I missed a bit of that question, but I think it was about testing in care homes for staff and residents. Is that right?
Nice.
Yeah. So the story there is, as you know, the government made me leap for joy, actually, in that when we heard that residents were going to be tested monthly and the staff were going to be tested weekly. There are really 3 vectors into a care home in terms of infection. There are admissions back from hospital, which we have systems in place to avoid. Great work with Sandwell and West Birmingham Hospital Trust on that, making sure people are tested before they leave. And we have beds where we can isolate people if they are COVID positive before they go into their home. The other vector, of course, is visitors, family residents. That probably nationwide has caused an awful lot of outbreaks because one thing we learned about outbreaks in care homes is they're often driven by asymptomatic infection. So it's not always someone who's coughing and running a high fever that you can easily spot. And the third vector in, of course, is staff. So when we had the 2 of those vectors, i.e. both residents and, of course, staff were going to be tested weekly, we were really pleased. Unfortunately, as many of you will have heard, the government had to abandon that system. I'm not completely clear why, but what we were told, it was problems with the administration and delivery of the testing kits. They initially delivered to care homes Randox testing kits, which is essentially a brand of testing kit, but they were then recalled as unsafe and unsuitable. And we've now been told that there will be a delay until the autumn, which is obviously really disappointing given what I've just told you about, my own personal reaction to the issues we had in care homes. To have that delayed so significantly was incredibly difficult. We do, of course, have a community swabbing team and we do have an outbreak response team. So when we see infection, we can get in and test ourselves. But of course, the capacity to test every single staff member in every care home every week, plus all the residents once a month, requires a government-sized delivery system of tests. The care homes were disappointed themselves. I spoke to a number of care home managers who said, we want to do this, and they had took training from us in delivering the tests, those that needed it. But unfortunately, that's on a pause at the moment, and I keep asking as do other DPHs.
Okay, Martin kind of follows that up, Lisa, with a question about where families can't visit their loved ones in care homes. He's heard in the media of examples where a public body, he said CCGs, but it might be local authorities, have provided iPads in care homes. Is that something you've had any experience of in Sandwell?
Yes, we have heard of it. I've heard of a few CCG, and well, for example, I know the hospital trust use technology quite well, and what we're doing at the moment is we're now looking for ways to firstly look at care home visiting to see how it can be facilitated in different ways, and of course that includes technology. We have used iPads before and FaceTime in particular, so we are looking at that. But what a lot of residents and relatives have appreciated is the ability to meet and see their relative through a window. It's obviously not ideal, but you can open the very top window. It provides a very effective barrier and you can see and hear each other. So that's another option as well. At the moment, it's one of the most heartbreaking decisions we've had to make to advise the care homes not to accept visitors, because I just can't imagine what it's like to not see your mum or your dad or your grandparent, and also of course for the resident themselves not to see the family, especially when someone was maybe living with dementia. But it would just be reckless at the moment to allow them in.
I'm going to bring some others in, Lisa, but Martin, I don't know whether you're on mute, but if you want to come off, is there any follow-up you want to ask Lisa on those 2 questions?
Oh, hi. It's actually Teresa Calderwell. Martin's had to go to work, unfortunately. Yeah, it's just that it's so difficult, and we have a severely disabled son, who we didn't expect to live this long. He's now 25. So of course it makes it even more difficult when you're sort of thinking, you know, life limited at some point, and particularly with Sandwell trends, you know that with disabilities and learning disabilities, the picture is even worse than the national picture. We have an even lower limit, life limit. So you can imagine it is very stressful. I mean, I'm not showing any emotion, but inside I'll probably feel it later. It is difficult, but I do appreciate that, you know, you are doing your very best. It's difficult when those messages, you don't see those messages. I understand. I've been on so many committees. I have heard people, sort of the professionals, saying, we have talked to our managers, to our senior managers, to people above them, and the only answer you get as a patient or a carer is no. And it feels like you're saying you're being awkward, but I do understand that, you know, you have to do these things. But it is so very difficult when it's important that the whole residents and the staff in care homes do get tested regularly. It really is important.
Yeah, and I think that if we, you know, one of the things that would help us move back to visits would be that testing, because, you know, we have a better early warning system then. The problem with care homes is you get a lot of asymptomatic driven outbreaks and you don't know about it until it's right through the care home. So testing would help. We do talk to families. I've been on the phone to several families, which is why I say the phrase that I can't imagine how hard it is, because, you know, they're describing a situation. I do have an elderly mum who's unwell, but she's still at home. I still don't, we keep our distance when we see her, and we don't go in the house. We tend to go for walks together. But of course, when somebody's stuck in a care home, you don't have that option. And it must be incredibly heart-wrenching. We will keep that under review, obviously. And if we can get that testing in place, then the risk assessment will change.
Well, the other thing as well is that the families need to get tested, because we can't guarantee that we're not asymptomatic.
Absolutely.
And of course, my husband, he's an optician, and he's gone back to working 2 days a week. So I don't know, and he's out of borough as well. So if we lock down in Sandwell, can he go out and then work, or does he stay out there in Birmingham and work and live in a hotel? There's a lot of implications with this as well.
Okay.
Thank you.
Rachel makes a point around people with sickle cell and thalassemia, high risk, vulnerable, and very afraid, particularly with local spikes. Before you joined us, Lisa, Deska also made a point about whether Healthwatch will look at the experience of particularly older black men through COVID. What kind of community work is going on around those areas at the moment?
In terms of BAME groups, you mean, John? Yeah, absolutely. So you'll know that there are two trends we've seen, both nationally and locally in Sandwell. A black or Asian man and woman, actually, slightly different figures, but a black or Asian person is about 4 times more likely to die of COVID-19 than a white British person. It's an incredibly stark inequality that COVID has shined a light on. Our community engagement has, to be honest, mainly been focused on BAME groups, especially, to give you an example, in Smethwick, we focused in particular on the Indian group, so that's specific, not just Asian, but Indian, because would you believe that over half of our cases in Smethwick were in that Indian group? And the reason for that, there's been all sorts of very stupid speculation in the media, mainly from people with a certain agenda, that, you know, it's somehow to do with a lack of social distancing by those groups or some sort of behavioural issue. It's absolutely not. There's no evidence of that. What it's reflecting is an interaction between the circumstances in which people work and the circumstances in which people live. And so, for example, in Smethwick, to give a very specific scenario, we had a very powerful interaction going on, and you can see this clearly when you look through the data, between large manual workforces, often, often maybe not necessarily showing great social distancing, great infection prevention control procedures, and then people returning to large multi-generational households. And so we were seeing clusters of cases in households. So that's a good example of how COVID has happened to BAME groups. And so I have no time whatsoever, I'm afraid, for some of the more slightly prejudicial theories on this. COVID shined a light on structural inequalities that we need to deal with. The communities in Smethwick and West Brom, and in fact across Sandwell, have been awesome. I can't tell you how good, for example, the faith leaders were over the last several weeks, especially the Muslim and Sikh faith leaders. It was really inspiring just before Eid. And again, I could see the sadness and hear the sadness in the imams and other faith leaders' voices as they had to cancel. Well, they didn't have to, as they took the decision to cancel very important Eid celebrations because they took their responsibilities to their community so seriously. Our engagement, of course, has prioritised information in different languages to the point where I was recently doing an interview on an Asian television channel, and as I was speaking, I was being translated into Punjabi at the same time, which I can tell you improved me. I just sounded so much better than this daft Scouse accent in this sort of silky smooth Punjabi voice that the presenter had.
Okay, just going to butt in there. Rachel just wants to have a more specific follow-up question, if that's okay with you. Rachel, if you can unmute.
Yeah. Hello.
I can barely hear you, Rachel.
Oh, okay.
Just shout. I can see your question about sickle cell.
Yeah. Recently, I think it was the 31st of July, there was a message about Sandwell having a potential lockdown and people who were shielding should continue to shield. Now, obviously with sickle cell, they were told, they had their letter from the NHS and they were told to shield, shielding could end for them on the 1st of August. So, I mean, I didn't have any information directly to myself, you know, as the CEO of Oscar Sandwell. So I checked online, and I think it was the Sunday, this message was still up on the Sandwell Council website. So I actually, you know, I sent that round via WhatsApp to let my clients know that actually don't go out there, you know, there's a spike, continue shielding. It is worrying, but we understand things are being done. But I think for me, it's about, you know, direct information to the organisations who are supporting the, you know, especially high risk communities, and maybe joined up. I had a meeting recently with, we had it with the CCG, and it's kind of like sometimes the information is either lagging or it's very, you know, it's very different. And we as the professionals, we have to go out and kind of source our own information. So just not sure.
Yeah, absolutely. I think it's a brilliant point, and probably one of our biggest challenges is getting the right information to the right people at the right time. So, for example, the shielding extension, which we just did for a week, while we had those extremely high rates, we've now reverted back to government guidance. But we got the information out on media, mass media, via the newspapers, and we also sent information around voluntary sector networks. I think one thing we could maybe look at, I think, as a product of this meeting, is looking at our mailing lists. And I wonder if maybe a small working group, John, including Rachel and a couple of others, could get together to find any gaps in our mailing list, because there must be, you know, I think there's somebody once told me there was over 1,500 community groups in Sandwell, and also of course in West Birmingham, which we don't cover, but we need to make sure we're joining up with Justin in Birmingham to get information out. So yeah, let's make sure we're plugging all the gaps in that, because information is crucial, as you've said, Rachel.
Brilliant. Okay, thank you. Lisa, have you got time for one or two more questions? I know you've got a very busy schedule.
I'm okay, John. Just go until.
Okay.
I've got another meeting, but this is more important and this is more fun as well.
I was going to say your PA manages you very well, because we were told we couldn't have you after 2. But I've now got Richard on the line. Richard's the chair of the Hospital Trust. Richard.
Hi, thanks very much, John, and thanks to Healthwatch for what you've been doing. But can I just thank Lisa? I have got a question, Lisa, but I do want to thank you for the leadership that you and your team have shown. You know, very clear communications and straightforward. So I really thank you for that. It's a fantastic effort, and it's great to see the care home position that none of us are happy with at all. But even so, it's the relative position of Sandwell is good to see. My question is around restoring services, and it's a question to you and to Healthwatch. Is obviously there is reticence for people coming back into hospital, and we're seeing what's the impact of, you know, delayed treatment or people being hesitant about coming. So I guess it's any observations you, and we can come back when you've left with colleagues from Healthwatch, about what we can jointly do to get people back into our spaces, you know, for some of the key things. And obviously we've been active, but you've seen the drop off in some of the key services, and there is there's an evidence of reticence of coming into the hospital spaces despite all the work we're doing on infection control and protections.
Richard and John, can I just show a slide just to underline the point Richard has made there? It's quite a stark slide to really underline what he said, because it's an absolutely crucial point. Sorry, there's me with my graphs again. But I hope you can see this. This is the mortality rates during the pandemic in Sandwell. And
Can you make it a bit bigger, Lisa?
A bit bigger? That's as big as I'm getting, I think. I'll also describe it. Sorry, this is from a PDF. I didn't think I was going to present this, but it's just, I think that point is absolutely crucial. Along these grey dots is the 5-year average mortality. And you can see how mortality rose way above the 5-year average. But what you'll really notice is it's actually the all-cause mortality as well as the COVID mortality, which exceeded the average. And that's really important, because, you know, the point you've made there is that COVID has caused indirect deaths because of people's reticence. And this is not a Sandwell thing, it's a national thing. Yeah, indirect deaths from people being reticent to access services, particularly urgent care services. Symptoms maybe of cardiac problems, or others have gone untreated because people are either scared because they've heard about infection rates, or a lot of people simply thinking the NHS is too busy. And I know the local NHS has been campaigning hard to say to people, look, we don't want you to stop using healthcare, especially now that mortality rates and infection rates have fallen. So I think we need to do everything we can to support hospital trusts to get that message out. Have you got any comments on that, John, as Healthwatch?
I suppose for me, it's all about stories, really. And if the story is people are scared, then that becomes self-fulfilling. So I guess what we need to do is get stories of patients that have
that's quite right, John. Yeah,
found it a good experience, or not as scary as they thought it was going to be, or it was quicker or different. So it strikes me what we've got to do, and then we've got to generate that in social media, in the real media, maybe try and get radio or TV to come in and just see the experience from a patient, because
well, we've had
you
some TV coverage on that very point, but I agree with you, John. I think that's a really well-made point. We have got stories, but you're a key collaborator, as is Lisa's team, with us getting message out there. And I think the other key thing is people know what to expect when they arrive, and we get a degree of consistency across different NHS spaces. I think, if you're going into let's say a Marks and Spencer, if it's the same in every Marks and Spencer as to what happens with hand gel at the door, you get confidence from that. And I think the NHS has got more to do across primary care, acute spaces, and different hospital trusts. We've talked about it, I know, at the Paul Mobeck level, but there's more we've got to do. But you're a key partner in helping tell us what messaging works and what doesn't, really. So, okay, thank you.
Yeah, no, you can definitely take that up. Lisa, sorry.
Before we move on, just a quick shout out, because Richard's on the call. If you ever need to commission and work with a community swabbing service, go to Sandwell and West Birmingham, appropriately named Swab. Their team has been absolutely astounding. When we have a major outbreak, it's absolutely crucial that we get dozens and dozens of people swabbed and tested literally within 24 hours. And the way they have been able to mobilize themselves and get places and do the swabbing so we can do the lab testing on them has been awesome. It's really...
Thank you. That's very kind. I'll pass that back. That's really much appreciated.
Yeah.
If John, I can just make one final point, which I'm afraid I have a personal interest. It's just the point about visiting is a tragic one. We have used a charity to go outside in the gardens at Rowley Regis and some of the care homes. That's a charity that would normally be on the wards, taking young people from Sandwell schools onto the wards, or from the college as hairdressing. Of course, they can't do that, but we're using musicians to go outside care homes and hospitals. And it's, to be honest, I mean, I'm a trustee of it, so I'm biased, but it isn't in London as well as Sandwell and Warwickshire. Kissing it better. And I will send you, Lisa, the stuff. It's been fantastic. But it's like the relief of Mafeking when they've had no visitors since March. Even just somebody singing outside and being able to communicate through a window has been a big deal, really.
Yeah.
Okay.
All we need to do on the visiting side, I think, as well.
With Toby as well from the trust. I'm conscious I've got a couple more questions from Teresa, but is there anyone else on the call that wants to come in before I go back to people that have had questions already? And then after that, I think we probably need to move on because I did promise a tight meeting. Any other new people want to make comments or suggestions, either to Healthwatch or Lisa, on the COVID situation? Okay, then Lisa, your PA told us very clearly 2 o'clock. It's now 2:10.
You don't want to mess with that.
Giving my little tribute to you, but actually, I don't know if you've seen the chat, but actually loads of people have repeated it and said things differently about your bravery, your tenacity, but your visibility. So on behalf of all of us, you are an absolute star. Thank you, and keep doing everything you're doing, because you make us all feel safer as well.
Oh, thanks, John. Well, it's a massive team effort, as I've said, and please do put out my email address if anyone wants to get in touch with any ideas or suggestions. Thank you, John. Thanks to everyone. Thanks.
Thanks, Lisa. Take care. Okay, folks, we're now going to go back to the other part of the meeting, which is really our review of what we've achieved in 1920 and what our plans are for the current year, I should say. We've got about 20 minutes for this slot, so I'm going to hand over to the staff team to run us through that, and then again allow the opportunity for some questions at the end. Thank you.
Okay, thanks, John. So the team are just going to do a brief sort of overview of what's happened last year and what we've been working on. So I'd like to hand over to Anita, who will give you an overview of priority projects that we've been working on, that we worked on last year.
Okay, thank you, Alexia. I'll do this as briefly as I can. Just want to tell the team and the meeting about 2 projects. One was about listening to carers' experiences in Sandwell, and one was a homelessness project. Quite briefly, we carried out the project to look at the support that adult carers were getting in Sandwell, and it was with the view to inform the joint carer strategy that the local authority, CCG, and the voluntary sector were putting together for 2020-24. We used a variety of methodologies, but we engaged with 227 people. And just to briefly say, it identified their levels of care and of responsibilities. 63% said they'd not had a carer's assessment, 57% said they'd used information and advice services. I just want to say thank you to everybody, because I know there are some people on the call today who contributed to that piece of work, so thank you. We've made a number of recommendations which are in the report, which I won't go into at this point, and we look forward to hearing from the local authority and the relevant stakeholders on the progress with the recommendations. The second project that I was involved in was how people who are homeless and rough sleepers access healthcare. The focus was around healthcare and not social care, because we had to narrow it down. We actively engaged with rough sleepers and with our partners, which I couldn't have done it without the partners. And the homeless take many guises: people who are registered or hidden homeless, sofa surfing, rough sleepers, and those in hostels. We created what I would call a community of practice with all the partners, people who have direct contact with this particular target group, and that was great. We used an online survey, but with printed copies, and our partners helped us with that. The plan was focus groups, but obviously with chaotic lifestyles that didn't work out. And we used assertive engagement techniques, particularly with environmental protection officers from Sandwell Council, who gave us access to people, and we engaged with over 130 people. I'm only going to give you 2 comments that came from it because of time. I make what people said. I make things up so I can stay in hospital longer to keep warm and to get a meal, but the doctors throw me out. I asked for counselling but had to wait for a letter. I moved again and never got the letter. It'd be better if they could text me. There are 7 recommendations. I don't propose to go through them now, but the good news is I was able to present the report and the recommendations to the Homeless Forum in Sandwell, that's chaired by Alan Caddick, the Director of Housing and Communities. He's incorporated all of the recommendations into their action planning document, where all the relevant stakeholders are there who sit round the table and they can pick up what they need to action. Some things are already happening. You know, I know public health are very much involved with like a passport style health to health card, so that's really exciting. And we at Healthwatch look forward to hearing about it. I'm going to introduce the next slide. It's got my colleague Leanne on. She's not here, but she's provided us with a message. Thank you. It's just coming on.
Okay, can we move on to the video?
Okay, I think the video is playing for some people and not for others. Is that correct?
Yes. Yes, that's correct. I didn't see it.
Okay, so what I'll do, I'll quickly just script what Leanne has presented, just so it puts things into context. So the project was about young people's views of health and social care, and we managed to engage with over 700 young people during the research to find out their experiences. And the recommendations out of the report was to establish a youth health watch in Sandwell, to raise awareness of services for children and young people in Sandwell, a review of mental health support in schools and colleges in Sandwell, and to look at the waiting times for specialist support for mental health. I'm grateful for Leanne who took time to do the DVD for us. Obviously, it will be in the slides and they'll be on our website. We'll post it out to you, so you'll actually be able to hear what she's got to say. So thanks, Leanne, for that. I'd like to pass you over to Melissa now, who's going to talk a little bit about the difference that we've made.
Hi, yeah, I'm just going to talk about some of the projects that we've been involved in recently. One of them is the long-term plan. The long-term plan started in January 2019, and NHS England published this long-term plan to set the ambition for healthcare services to work better, to help people, and to help people stay well and get the best care they need. The implementation of the long-term plan will occur over a 10-year period. All health watches were called to input into the long-term plan, and our work fed into the Black Country report. This comprised of questionnaires and focus groups, and it led to recommendations relating to communication. People wanted a variety of communication offered to them. They wanted medical professionals to speak in plain English, and also the leaflets to reflect that too. They wanted them to be in plain English and just understandable. NHS offers courses to help people stay healthy, but they want that to be more accessible and more of a one-stop shop for health and care services for GPs and community support. The second project I'm going to talk about is the General Practice Nursing Report. This was a project that we did with the Black Country, and this was well, quite a few focus groups were all linked together. 6 common themes were discussed: were understanding roles and skills, appointment preferences, availability of appointments, benefits of nurse appointments, information sharing and signposting. And from that, it was decided that more information needed to be available about nurses, the knowledge and skills they actually had in individual practices, because they can vary so much depending on the size of the practice. Also consider how to provide information which will reach a wide range of patients, including people who do not use the internet or do not visit the surgery often, and just make nurse appointments available online and not just GPs. Okay. I will now pass on to Anita, and she will discuss the project.
Sorry about that, I was muted again. I had a wonderful opportunity to share, do a piece of work with the Sandwell Deaf Community Association, and we've developed a focus group. We've had one meeting, produced a report of that's on our website, where they talked about their experiences of health and social care. Their biggest issue is relating to having a British Sign Language interpreter at appointments and consultations, but also a good quality one as well. I'm continuing to work with the deaf community and the SDCA, and we're organising another meeting for the autumn. Thank you. And I'm going to hand over to Ian, who's now going to talk about entry and view briefly.
Thank you, Anita. During the year, we published 9 entry and view reports before our activity was suspended in March. We visited GP practices, care homes, a daycare service, the CAMS service in West Bromwich, and Sandwell Hospital. Our report's made 32 recommendations in all, and we've received feedback from providers on 12 of those recommendations. When we do resume entry review activity, we will revisit to see how our remaining recommendations have been accepted. Some of the examples we made were further promotion of PPG groups, encouraging more patient feedback and action on feedback reported back to patients. And now I'll pass on back to Melissa, who will talk about volunteering.
Melissa, are you there? You're on mute if...
Oops, sorry. I thought I'd left it off, sorry. Hi, I manage the volunteers, and we have had 9 volunteers that have helped us with various projects over the year. They've raised awareness of our work that we do in the community events and healthcare services, visited services to make sure they're providing the right support to people. They've helped day to day. Few have helped in the office, and that's been really good, and listen to people's experience to help direct our work as well. The work that the volunteers do is extremely valuable to us, and in return they acquire new skills and knowledge, and yeah, we just want to thank the volunteers. Thank you. And now on to Sophie for signposting.
Hello, thank you, Melissa. Yeah, Healthwatch help people with issues around health and care services that need resolving, so we direct their route there. We also deal with how people get through complaint processes, and we signpost people to support services in Sandwell, including the voluntary and community organisations. We provide information on our website and promote it via social services media, any service changes as well that we are aware of. We answer queries on the phone, email and online, and we meet people through community outreach work and attending community events and meetings. We engage with local support groups as well, attending their meetings. So support groups like, for example, long-term conditions, Parkinson's, for example, autism, sickle cell, the deaf community and the visually impaired. Last year, 50% of our signposting was to power NHS advocacy services to help people resolve complaints, and also directing people 15% to GP practice managers to resolve issues locally, 19% to hospitals across the region through the PALS and local resolution services. We also signpost to support services in the community, such as aAndwell for old people, youth support, and young carers, mental well-being such as Kaleidoscope and Sandwell Healthy Minds. And recently we've been doing a lot of community signposting to the community support around COVID-19 and the NHS responders. We try to do the best we can on that. I'm going to pass on to John now to just introduce our priority projects for next year.
Thank you. So up to now, we've really been focusing on what we have focused and achieved in 2019 and 20. And by getting all the staff to talk, I think it shows the sort of collaboration and teamwork we rely on. All the details of what we did last year are in our annual report. It's on our website. Please take time to read it. And if you've got any questions, please come back to us. Obviously, our whole role is about listening to local people, and they help set our priorities. So earlier this year, we did surveys, we talked to commissioners, providers and the like about what they think our priorities should be this year. But most of all, it is guided by members of the public. And the areas that we will be focusing are around the responses to COVID, around mental health and well-being, around digital technology, and continuing our work around Young at Healthwatch. To just flesh that out with perhaps a minute on each, I'll hand back to Anita and Sophie. Thanks.
Okay, thanks, John. I will keep this very brief. Our project around mental health and COVID will be aimed at the population who've already had mental health issues prior to the pandemic, as well as those whose mental health has been affected by COVID-19. Our objective is to understand the impact of COVID-19 and and get a picture of what services people have accessed, and we'll probably link in with priority 2, which Sophie's going to talk about the use of digital technology. And I want to learn about people's coping mechanisms, what's built their resilience, because Sandwell in the Black Country, a lot of people have got really good coping skills and want to develop that further. Methodology is going to be very simple: phone calls, using technology like this, and possibly a survey. We really want to make a difference to services that people receive to ensure that they have a good quality, not just their physical health and their mental health, because the two go together. Sophie.
Thank you, Anita. Is that okay? Yeah. Our second project is around digital technology and primary care services and the use of that. Previous surveys have informed us that people in Sandwell, 74% have problems with making or receiving GP appointments, and 60% prefer face-to-face. COVID-19 has imposed significant changes on primary care services, including greatly enhanced technology, and appointments have predominantly been through the telephone or video consultations. On speaking to people in Sandwell, we find that people have actually adapted quite well, but we recognise that some people won't be able to adapt to the digital offer, technology, and may need support to do so. There may need to be some measures put in place to overcome barriers, and alternative offers will also need to be made. Some people who might struggle more with technology would be some older people, people with learning disabilities or autism, the deaf and blind community, and people whose English is not their first language. Healthwatch proposed to run the project through mostly survey work and focus groups to understand how people are coping with the technological transition and what might be needed to support services going forward. Healthwatch would like to work collaboratively with the primary care networks on the project. We know that the outcomes will help inform the digital ambitions within the local NHS services. Thank you. I'll pass to Alexia now.
Hi, the third project that we have is born out of the recommendations from the Young People's Project that some of you heard about earlier from Leanne, and the script that I put together. So, as I said, out of the recommendations came the development of a youth health watch to complement the work that we already do. And over the past few months, Leanne has been working with a number of local people to get this off the ground. It's currently 6 or 7 members, which have put together a short presentation to be presented at this meeting. But I think because we're having so much difficulty, and people can, and some people can, some people can't, I think that will be available through our website and obviously through the PowerPoint slides. I'm really disappointed actually that they can't, you know, we can't get this sorted and resolved, as they put a whole heap of work into it, obviously through lockdown and working virtually. So hopefully, you know, you'll be able to view that through our website or through the PowerPoint slides that we will send out to you after this meeting.
Okay, well, thank you, everybody. Any questions on either Healthwatch's work last year or our plans for the current year? Oh, it looks like the video is working.
John, I cannot see the video. Apologies.
Okay, I'm hearing from people that some people can't see the video. For others, it's started again. So I'm afraid I'm really disappointed because the young people have worked. It's their work, not ours, and they wanted it to be shown today. But we will ensure all this stuff goes onto our website and we can email the link to you after the meeting. So apologies around the young people's priority. Has anyone got any questions about our work or forthcoming priorities?
John, it's Richard Samuda here again. It was only just to say if there's anything the Trust can do to support, particularly your young people's work about getting, obviously we're trying to get more people into healthcare, and we are very active as a Trust. I think we're one of the most active in the country on apprenticeships. So, and I don't know the answer, but if we're not connected sufficiently to what we're doing through our HR and our live work scheme, which is a physical scheme next to the new hospital site about getting people into apprenticeships, and if we're not connected up enough, can somebody follow up? By all means, use me.
Brilliant, Richard. That's a very kind offer. I don't think we have got that link as well as we should have at the moment. I mean, it is quite embryonic, but
no, that's fine. But if you've got another channel to young people, we ought to be listening to what you're doing more carefully. So thank you.
The slide you can now see is, some of you may be aware that the CCGs, which are basically the purchasers of healthcare in our area, have been working closely together for about a year now. They've now are consulting on a formal merger of the 4 Black Country CCGs. They're called Clinical Commissioning Groups. We are hosting a public meeting with the CCG in Sandwell and West Birmingham to ensure they hear the views of organisations and members of the public. Unfortunately, their chair, Dr Ian Sykes, hasn't been pinned down on a time yet. We do know it will be on Thursday, the 3rd of September, and we hope many of you will come and will pass the message on. As soon as we've got absolute details, it will be a virtual meeting. We'll ensure you get them. It is 2:30. I promised to finish by 2:30, so I am going to say thank you both to our staff, our volunteers, our board, but most of all you for coming. I've got 2 members of our board on with us today, Bill and Dave. Thank you for your commitment. We are really short of board members for Healthwatch. We need leadership that represents a diversity, and if any of you know people or know yourselves would be interested in that role, please feel free to contact me or Alexia or any member of staff. I'm going to stay on the call for 5 minutes in case anyone wants to follow up anything, and I'm sure Alexia will as well. But on behalf of the whole team, can I thank you for your contribution this afternoon? Thank again, Lisa, and wish you a humid afternoon. Thank you very much.
Thank you. Thank you. Thank you, John.
Thank you, John. Thank you, John.
Thanks, Bill. Nice to see you. Brilliant for you getting on.
Yeah, just about.
I hope your wife's taking a photo, Bill.
Yeah, she just moved away from me. Anyway, thanks, John. Very good.
All right. All right, you take care, Bill.
Bye, Bill.
Bye, Bill. Yeah, bye-bye.
Before we just open up to the staff, if there's anyone, members of the public or organisations that do want to raise anything with us, as I said, we'll stay online for a couple of minutes just to allow that. So we just pause for that, and then if we don't get any takers, we can just review as a staff team.
Okay.
I noticed Mandy Punia, who's from another Healthwatch, Walsall perhaps, It says she's here, but she's in a call, but she is a Healthwatch colleague. So I'm not sure if she's still within this meeting too.
Thank you. And I think I can see Natasha's still on the call. Natasha, if you've got anything you want to add, please feel free.
No, thank you. We might
can remove her.
Yeah, if someone's not left, yeah.
Yeah, you can remove. Do you want me to remove her, Natasha?
It doesn't look like she's live, so probably.
She's silent. I'll move her now, all right?
All right, yeah. Thank you. And Mandy is the chair of Healthwatch Walsall. So Mandy, thank you very much for joining us. If you are still on the line, we'll say goodbye to you now, but thanks for joining, and I'll welcome any feedback after the meeting. Bye, Mandy.
Thank you, John. Thank you for hosting the meeting, and very informative indeed. A great speaker as well, I have to say.
Lovely, brilliant.
Thank you.
Thank you.
I think, is Aileen still there, or has she gone?
I can't see anyone else showing up. Just
so whoever's in control, can we just take Mandy and Aileen off the call now?
Yeah, I'll take Aileen off. Oh no, it says asked to join. I think they've gone.
Okay, fine. Well done all. Congratulations.
Melissa, stop sharing your screen.
Okay.
Oh, and stop recording as well if you want to.
Yeah.
Oh my days.
You can all breathe now and